So it looks like we have a patient coming in today for an annual physical checkup. Perfect. Let's send them on in. Perfect. Hello there. Welcome to Dream City Clinic. Are you here for your annual physical and checkup? Perfect timing. Please do come on in and make yourself cozy. Do you see you brought a parent with you here today? Parent, if you could just take a seat next to me on the seats over here, okay? And if you could just take a seat right at the examination chair right there. Yeah, just get cozy and sit on top of it. Perfect. Thank you so much. I am Nurse Nosy. Pleasure to meet you. Truly pleasure. And what a beautiful day it is today, right? Exactly. So I hear that you are here for the annual physical and checkup. Is that correct? Perfect timing. And the doctor will see you after I take your vitals and ask you a couple of series of health questions and do a couple of health assessments, okay? Perfect. So this exam also involves a lot of personal questions that you may not want to have a parent around for. No worries, do you? But if you ever feel uncomfortable and want to kick them out, please do so, okay? You get the rules, right? Good. So this is all about you and your health, and I'm going to ask you some personal and quite detailed questions about your health, okay? Good. So first I got to sign you in here. Can you tell me your first and last name? Beautiful name. And how do you spell the last name? With an I? Okay. Or an E? Okay. Got that. Beautiful name. And when was your birthday? Good. Just making sure. What year? Okay, good. And do you still live in the same address as you do on your form here? Yeah, it's the one that your insurance has. It's at the same address. Good. Very good. And I do see here, before you walked in, you had your height and your weight checked. Just got that filing here. So I do see that your height's the same as last time, as written here on my paperwork. But it does see that your weight has fluctuated. Do you want to talk about that, or is that nothing you want to talk about? Okay, because we can talk about diet, exercise, and evaluate your lifestyle if you'd like. No, causes a bit of stress. I understand that would cause me stress too. I just have to ask, okay? So thank you so much. We're first going to begin with understanding more about you and taking your vitals, okay? And I'm just going to start off first by putting my computer away. And we're just going to take some vitals, okay? Okay. I'm going to start off here by getting your temperature, okay? Have you been sick or had any flu-like symptoms in the past 2 weeks or so? 14 days, okay? First, I'm going to take your temperature here, and I'm going to scan your forehead with this thermometer, okay? So just sit still. Looks like your temperature's good there. I'm going to scan your forehead. Is that okay if I touch your forehead? Thank you. One more time. Temperature is perfect. Thank you so much for that. Okay. I'm going to look at you first. It looks like all of your body is proportionate. Have you had any problems with your body, such as maybe your head, some headaches, perhaps some lymph node problems, ear problems, eye problems, throat, shoulder, hips, stomach, legs, feet? Good. You've never experienced anything like that. Okay, good. I'm going to get up close to you here, okay? I'm going to ask you, can you open your eyes as wide as you can for me? And can you close your eyes? Okay, your eyes are a bit dilated, okay? That means I have to ask you just a quick series of questions, okay? So again, if you don't want your parent in the room for this, we can kick them out, okay? Do you do any of that with anybody? Yeah? You feel uncomfortable having your parent in the room for you? I'm sorry, but we're going to have to kick you out, okay? We'll bring you back in when we're done. Okay, go on now. Okay. Now, do you do any of that? Oh no, I'm not writing a lot of this down. I'm just writing some details, okay? And what else do you do? Okay, good. Thank you. Are you someone who has like a lot of partners? Are you someone who has one person? What do you do? Okay. All this information will be private, by the way, trust me. No, I'm not writing a lot. I'm just writing a couple of details. Okay. And are Are you someone who perhaps partakes in some nefarious activities? That being, perhaps sometimes you will have a drink in a while, or sometimes you'll participate in any types of medicines that you take. And what do you do in detail? Thank you. You can be honest with me. This report will not be shown to anyone other than your doctor, and it will be hidden from online records, okay? Good. Don't want any parents knowing, because trust me, back in my times, we had a lot of fun. It's okay. No one here is going to judge you. Okay, and how often do you do these things? Okay. Oh, okay. Okay. I think you're just trying to get a little bit of the details, and thank you for being so kind and telling me so much. And again, if you want to refuse any of these questions, you don't have to answer them, but to benefit your health records, we totally need them. Just making sure we got you here, okay? And are you someone who drinks a lot of caffeine? Are you someone who gets anxiety? Or perhaps you get a little bit quiet or silent during the day? Sound a bit like me. Okay, just kidding, but truly. Okay, so thank you so much for allowing me to answer those questions. I'm going to continue taking your vitals now. And I'm going to just put this pulse oximeter on your finger. If you could put your hand out for me. Yeah, it doesn't matter which hand, just put a hand out. Good. Do you see that you're wearing nail polish? So I'm going to ask you to turn your finger a little bit while I scan this, okay? I'm just going to put this right on your finger, okay? And we're going to let that sit while I examine other parts of you. Good. So what I'm going to do first is just taking your vitals. I'm going to ask you to follow the light and look at this light, okay? I have a pen light here, and it's just to assess your eye health, okay? And you said you had no problems with your eyes. Good. Take a look at the light. Okay, and okay. So first thing I see is that your eyes are dilated and quite red or irritated. Now I'm going to ask you a couple of questions. You have to be honest with me, okay? Or if you don't want to answer, you don't have to. Are you someone who has allergies or light sensitivity issues? Something before you came here to calm your nerves? I know I have in my past. You know, sometimes you get a little bit anxious for the doctor's office, especially coming with a parent. Okay, keep it on the low if you have any information like that, okay? But thank you for letting me know. Gonna look at your other eye, okay? Just going to take a look here. I apologize if my breath is kind of gross. I did just eat a little bit of food, but I do have to just examine you, okay? Good, thank you. Can you look at me? Can you look over here? Can you look over here? And above? And below? Now what about over here? And what about over here? Look up and look down. Reflexes seem to be good. Can you quickly follow my finger? But don't move your neck or your chin to do that. Just use your eyes, okay? Perfect. Just follow my finger. Good. We test something that's called the H formation because it tests the boundaries of your eyes, okay? That also tests to see if your cranial nerves are functioning properly, all 12 of them, okay? Good, thank you. So, I'm going to pull the light back in real quickly. I'm going to cover one part of your eye, okay? If that bothers you, let me know. Good. It's going to shine the light into your eye. Okay? Good. Okay, bring that a little closer. Your eyes are quite dilated. I might need to write that down a little bit, okay? But if that is in conjunction with something else, you know, perhaps you're participating in a couple of, you know, nefarious activities. I'm gonna write that down, okay? Good. On to the other eye, okay? So, let's test the other eye. Kind of just cover up one of your eyes, okay? And can you still see the light? Good. Perfect, okay. Any light sensitivity right now? Good. You're doing fantastic, okay? I'm going to put this light down just for a second. I'm going to get that pulse oximeter off of your finger. Can you just give me your hand? Thank you. So it looks like your beats per minute for your heart rate was sitting at about a 90. Are you a bit anxious or nervous? Yeah, I understand. Don't worry. I'm always anxious if it happens to me too. No worries. And your blood oxygen level is at a 99%, which is perfect. Thank you so much. I'm going to put this back in the container. And I'm now going to just test your heart rate, okay? I'm going to use my stethoscope here. And it's It's freezing cold, okay? I'm not gonna lie to you, this is freezing cold. It's going to make you feel like you're going to get goosebumps, and especially because hospitals and clinics are already freezing as it is. I do apologize if this gives you a shock, okay? So, what I'm gonna ask you to do is I'm gonna ask you to breathe in deeply 3 times before we test the first time, okay? This is to assess just your normal plateaued heart rate, okay? Good. So breathe in, breathe out, not too deeply, because sometimes you can fart. I've done that in front of a nurse before and it embarrassed me, okay? Breathe in and breathe out. Breathe in and breathe out. Now, apologies for this being a bit cold, but I'm going to put this right on your chest, okay? Now let's measure your heart rate. Good. Okay, that sounded quite normal. Very good. I'm going to test the other side now, okay? And relax. I do apologize that it is so cold. And relax. Very good. I'm going to put this now just on your chest. We're going to just listen to your breathing, okay? So just breathe in with your nose and breathe out with your nose. Do it with me, okay? Breathe in and breathe out. Breathe in and breathe out. Breathe in and breathe out. I'm going to put this on your back. Let's do the same. Breathe in. Breathe out. Breathe in and breathe out. Okay, that sounded good. Now I'm going to put this on your stomach, okay? And we're just going to listen to the inside of your stomach. Have you had any problems with bowel movements? Are you someone who suffers with constipation? Or someone who suffers with leaky bowels? Anything like that? Okay, and how's your diet been? Do you make a lot of food at home? Are you someone who eats often out? Yeah, a lot of McDonald's? Taco Bell? Okay, yeah, let's listen to your stomach first, okay? Just breathe in and breathe out. I'm going to move this to the upper part of the lower abdomen, okay? Just relax. Okay. Are you having any pains with your stomach at all? Okay, I'm just going to write that down, okay? So, sometimes a little bit of a lower quality diet can lead to a lot of stomach problems. Thank you for being honest about your diet and how you've been handling things, okay? Have you noticed that you've been feeling a bit overwhelmed with life recently? Me too, honestly, I understand. I also eat a lot of fast food, especially because I feel like my days are more rushed. I understand, it's okay. And I'm not going to judge you here, but how often would you say you eat a proper nutritional meal a day or a week? Okay. And how often would you say you go out for food? Okay, understandable. Thank you for being honest with me. This is just to write down all of your health stuff. And especially because your health and your gut health, especially with your bowel movements and the way that you live life, things like this are quite serious. And we take your health very seriously here. So you should be thankful that I'm asking about all these questions so that we can better assess how you can be and how you can feel better. Okay? Thank you. Just writing that down now. Okay, I'm going to put the keyboard away for a second, okay? And now I'm just going to take a look at you. I'm going to feel your lymph nodes, okay? So I'm just going to feel if there's any problems there. Any sore throat or any type of problems with your mouth recently, okay? Feel your lymph nodes, okay? Okay, so I don't feel any signs of swelling. Okay, and can you do something for me? Can you open your mouth and go, ah? Good, and can you just swallow? Thank you, very good. So, what I'm going to do now is, got a little bit of this, and I'm going to be taking just a little bit of samples from your and your throat. And I'm going to be checking the inside of your mouth health. Is that okay with you? Good. So, all of our tools are wrapped personally. And I'm going to ask you if you can just open your mouth for me, okay? Just go, ah. Just go, ah. Good. Taking a look at the back of the throat. It looks like your tonsils are looking good. Okay, it looks like your teeth are looking healthy. Okay, it does look like you have a bit of a dehydration going on here. Okay. Are you drinking enough water in the day? You should be drinking pretty much about like a liter a day, okay? And typically people say about 8 cups, a cup being 8 ounces each, okay? And you don't have to drink that much. Okay, how often do you use the restroom a day? Okay. And do you have any problems using the restroom? Okay, thank you. Okay. So, looks like the throat looked good. I'm going to pull out these sterile little cotton swabs here, okay? And we're going to be testing just your nose and your throat. And this is what we do for general protocol. So, gonna just look up your nose for a second, okay? Just tilt your head up back. Thank you. 1, 2, 1, 2, 1, 2, 2. Okay. I'm just gonna swab the inside of your nose, okay? Just going to. Okay. Sorry if that made you feel like you need to sneeze a little bit. The other nose now, the other nostril. Okay, good. This will be sent to our laboratory. And then I need one more just for the back of the throat, okay? Just go off. Apologize to bother you, just going to. Just the back and the sides of the mouth. Very good. This will also be sent in. Thank you so much. And this is going to be disposed of. Very good. So, I'm going to quickly get your reflexes now. Is that okay with you? Good. So, I'm going to ask you to look at me. Good. Look at the wall. Look at this side of the wall. Look at this side of the wall. Okay. Can you look at the Snellen chart I have behind me? Can you read the bottom line? It's quite difficult. I'm not able to either. Okay, good. Can you read at least up to number 5? And what does number 5 have? Read the numbers out to me. Read the letters out to me. 5 says P, E, C, F, T. Very good. Now I'm going to test your reflexes, okay? I know I asked you a bunch of questions, but please try not to slap or kick me, okay? Understandable. It's happened before, and I don't want it to happen again. So, I'm going to ask you first. I'm going to test right here on your forehead. I test like this on the face, where I just put it on top of my fingers to see if you have a reflex, okay? So right here, let's test. 3, 2, 1. Good. Looks like the eyebrows flinched. Very good. Now on the cheek. Good. Now on the other cheek. Good. Look at me. Good. Now I'm going to test your chin. Okay, the mouth moved. Perfect. Going to test right here on the collarbones, okay? So just right there. Reflex is good. Reflex is good. Now to test the inside of the arms right here, okay? Give me one of your arms. Thank you. And one more. Good. Looks like the hand reflexed well. Let's test the other side. Good. Very good. Okay, now let's test the hands. Give me your hands. Just do this. Good. Perfect reflex. Perfect reflex. I'm going to move down to your knees now. Okay, try not to kick me. Okay, 3, 2, 1. Ooh, good reflex. Good reflex there too. Perfect. Looks like your reflexes are working great. Okay. I'm going to move on now to taking your blood pressure. I always do this near the end of the exam because I get a lot of anxiety. And when this happens in the beginning of the exam, I feel nervous for the rest of the exam. So I do it afterward. What I'm going to do is I'm going to wrap this around your arm. And we're going to guess and get your blood pressure through this gauge here, okay? And I'm going to be hearing your heartbeat while we do that. So I'm going to need some silence, okay? Just a little bit quiet. And I'm just going to put this around your arm. Is that okay with you? Good. I'm going to be using all my tools here for this. Quite fancy. So I'm going to wrap this around your arm, okay? Okay. And then going to put this right on your arm to hear your heartbeat. Then I'm going to put this pressure gauge, and we're going to just put pressure in your arm. Let me know if that feels uncomfortable, okay? Good. So here we go. You okay? Good. Good. Are you doing okay? Any pain? No? Good, good. Okay, looks like that's at its maximum. I'm going to read the pressure now. That is a perfect blood pressure. Good. Let's take that off your arm now, okay? Good. Yeah, let's just release some of the pressure. Very good. Thank you so much for being so patient. Thank you. Good. And I'm just going to now look at the arm. I'm going to make sure that your arm is not swollen right now, okay? Good. Keep still. Good. Good. And can you just move your hands like this for me? Wiggle your fingers. Very good. Thank you so much. So, one of the last things I'm going to do is I'm going to look into your ears, okay? And what we always do is we always test your ears. And then I always leave you off by just testing your blood sugar level, okay? So, I'm going to get the gauge here, okay? I'm going to pop a new little ear thing on here. This is an otoscope. I'm going to look inside your ears, okay? Let me know if this bothers you. Okay. I'm going to be honest here. It looks like you have a lot of wax in your ears. Your ears look a bit inflamed. Are you someone who isolates themselves, maybe wears headphones all the time and pumps a lot of music in their ears? Yeah, that can cause a lot of wax buildup. And are you someone who generally cleans your ears in the shower? A lot of parents don't teach their children how to do that. Okay. So next time, I'm going to ask you to try not to put so much pressure in your ears from the headphones, okay? And try to clean your ears. Good. Let's test the other ears. Okay, same with this one too. I'm just going to go in really quick with a cleaning method. I'm just going to get that out, okay? Just going to get a little bit of the wax out, okay? And you don't use Q-tips, do you? Good, you're not supposed to. Let a professional clean your ears, or what you could easily do is get some hydrogen peroxide in your ears, let it sit for a minute or two, and then tilt your head the opposite direction, let the hydrogen peroxide leak out, and so will the earwax if it bothers you, okay? It's going to clean it over here. Very good. Let's test the other side. Okay, looking cleaner already. Okay, I'm going to quickly test your ears right now. This is a tuning fork. It's at a very high frequency, and you let me know if you hear it or not, okay? Good. So let me know if you hear it on your left or your right side. Could you hear that? Good. And could you hear that? Good. Thank you so much. I'm going to take a quick look into your ears one more time. Looking very clean. Good. Cleaning your ears is actually a really big part of your health, and sometimes you can actually have a bit of hearing problems where you are unable to hear, or if you have an ear infection, it can get pretty bad. I actually am partially deaf in one of my ears because I had an infection that led on too long. It's very common, okay? I'm just letting you know so you don't end up like me. Okay. I'm going to take a little bit of this in here. Looks a lot cleaner. Perfect. Do you know if you have any hearing deficiencies at all, or hearing sensitivities where things bother you or things make you feel uncomfortable, maybe some vertigo? None? Okay, good. And last but not least, I'm just going to take a little bit of a a sample of your blood so that we can test your blood sugar level. Is that okay? Good, thank you. Give me one of your fingers. Thank you. Now I'm going to just push this tool in, and then I'm going to get my gauge, and we're just going to gauge your blood sugar level, okay? And did you eat today? Have you fasted today? Okay, good. Thank you. So I'm just going to test your finger. 3, 2, 1. Didn't feel a thing, right? Good. And then let's get the gauge. Good. So right now at your resting blood sugar level, you are at 100. That's perfect. Thank you so much for allowing me to do that. And just going to put a couple of my tools away. And we're going to allow the doctor to come in and finish with the rest of the physical. Thank you for asking all my personal questions. I'm going to just quickly write that down now that we have to send your nose and your throat sensing to the lab. Trust me, they won't test for any nefarious activities. It's just for bacteria, okay? Okay, you're good for me. I will write that down so that no one texts you. And I'm going to also suggest for you, just for you, okay? Don't let your parent know that I said this, okay? Next time you come into the doctor's office, try your best to get your parent, if you're feeling comfortable with them, to not come in the room with you so that it doesn't feel so awkward asking so many questions with them around, okay? Okay. Thank you so much for coming on by. The doctor will come and see you in shortly. I'm just going to finish writing down a couple of my notes here. And your health is wonderful. You are wonderful. Thank you so much for being my patient today and dealing with me. A lot of people think that I might be a little bit too TMI, but trust me, these are all questions for your health, okay? Okay. Thank you so much for coming on in. And trust me, your secrets are safe with me. And they're also on this computer, just a couple of them, not all of them in detail. But the doctor will come in and see you shortly to finish the physical, okay? Good. Thank you so much for coming on by. Cheers.